Welcome to Module 4. Where do we go from here? A resource for the implementation of strengthening partnerships, a framework for prenatal through young adulthood family engagement in Massachusetts. This session focuses on how to use the strategies in the framework to enhance family engagement programs and practices, particularly in transitions and strengthening capacity. Other sessions in the series include an introduction to the framework, a deeper dive into the framework, and culturally responsive family engagement practices. Here's an address where you can download the entire framework. Feel free to pause this recording, write that down, and then resume when you're ready to continue. The intended outcomes for this session are to give participants a higher understanding of the different types of transitions and strategies to strengthen capacity for family engagement. Participants will learn how to support families in transition and capacity building strategies they can utilize within their own context. Let's start today by defining the framework. Merriam-Webster defines a framework as a basic conceptual structure or the skeletal or open work frame that supports a structure. The Massachusetts framework was designed with this in mind. The framework was developed to give organizations, families, policymakers, and other stakeholders a roadmap to create equitable family engagement policies, programs, and practices to build the capacity of both families and professionals so they can develop meaningful partnerships that contribute to child and youth success. This is an intentional approach that will engage all practitioners and families, not just families with privilege. The framework was developed with key state and regional partners. The coalition includes state level organizations, families, and practitioners. Practitioners include the perspectives of health, libraries, museums, early education and care programs, home visitors, human services, school and district administrators, and higher education faculty, just to name a few. Over the course of 2 years, more than 500 members of the coalition participated in meetings to develop the roadmap that built on existing family engagement frameworks and integrated principles of equity and cultural responsiveness. This framework now provides an aligned approach and a common language for engaging with families. Additional research that contributed to the development of the Massachusetts framework came from the Dual Capacity Building for School Family Partnerships framework, the Parent, Family, and Community Engagement Framework for Early Childhood Systems, Strengthening Families, and the Maternal and Child Health Family Engagement Framework. There are 4 elements that provide a foundation for this framework. Each element builds on the previous element. The first element is building positive relationships. The second element is promoting family well being. The third element is promoting pathways for partnerships with families. And the last element is supporting child and youth development and learning. Each element builds on the one before. So, practitioners are more likely to be successful in connecting families with community resources that support their well being and supporting them in assisting their child to achieve developmental, learning, and health related goals when families have been given a range of opportunities that meet their engagement needs. Underlying all of these elements is the understanding that families play the most pivotal role in this partnership and decide the trajectory of the relationship. Practitioners need to meet families wherever they are and focus on their individual needs and expectations. Additionally, they should also recognize diversity, such as cultural diversity, multilingualism, and diversity in family structures, as assets that can help to foster positive and healthy partnerships with families. The icons you see here represent each of the elements throughout the framework. While the framework addresses the four elements mentioned on the previous slide, transitions is a topic that the coalition felt warranted its own chapter. In the course of the framework development, families, practitioners, and state coalition members identified many transitions that children, youth, and families experience in the course of their lives, from prenatal up through young adulthood. Changes in family circumstances, experiences, structures, and living arrangements are a normal part of life, but change is hard. So, transitions are vital opportunities for practitioners to engage families by offering leadership and advocacy opportunities. So, let's take a look at how the framework addresses transitions. Cowan defines life transitions as changes that involve qualitative reorganizations of the self and the inner world, social roles, and close relationships. Some transitions are developmental and predictable for a considerable number of families, whereas some other transitions are experienced by fewer families and are less predictable. Developmental transitions usually follow biological, psychological, or social norms and are heavily influenced by culture. Every culture defines its own transitions. As we mentioned earlier, transitions are vital opportunities for practitioners to engage families by offering leadership and advocacy opportunities. Practitioners can help families to successfully navigate transitions by helping them anticipate them and by jointly establishing transition plans. For the purposes of this framework, transitions are differentiated into four types: child, youth, and family development transitions, everyday transitions, systems transitions, and unanticipated transitions. Child, youth, and family development transitions are those that arise as a result of changes in age and developmental stage of children and youth in the family, including the transition to young adulthood. Everyday transitions, as the name suggests, arise from the daily changes in situations and circumstances faced by family members. Systems transitions are those that arise within and across systems when families have to navigate multiple systems, such as health, education, and human services. In addition to the transitions experienced by a considerable number of families, this framework also refers to unanticipated transitions. Those are transitions generally experienced by fewer families, like losing their housing arrangements, financial stability, or changes in their family structures. The framework illustrates the different types of transitions at different stages of a child or family's life. Some of those transitions occur from prenatal through early years. Some of them occur from elementary to middle childhood, and some of them occur from adolescence to post secondary. The next few slides will show just a few examples of developmental transitions. Child and family development transitions also require recognizing and providing for either physical needs, social emotional needs, or cognitive needs. The framework includes examples of the many and varied transitions that families experience. Although this framework distinguishes between different types of transitions, it's essential for practitioners to recognize the intertwined nature of transitions. A transition in any sector of the system, health, human services, or education, and experienced by any one family member could affect the entire family and the family's experience in the entire system. Children and youth experience a lot of transitions. For children in the prenatal through the early years, those transitions include things like fine and gross motor skills, as well as their vision and hearing. They are often relatively rapid developments we enjoy watching. As children enter the elementary to middle childhood period, those transitions include things like experiencing puberty and changes in personal hygiene. And as they mature from adolescence to young adulthood, they experience transitions related to their sexual health and identity. They begin to practice self care and self management of their health and related needs. As we recognize the physical transitions children and youth are experiencing, we have to work with their families to ensure they have all the support they need. There are a variety of developmental transitions that children and youth experience related to their social emotional needs. For very young children, the developmental transitions include developing attachments and relationships. They begin early social skill building, play, and identifying emotions. When they reach elementary to middle childhood level, they begin to learn self regulation. This may be a time they begin to experience bullying or cyberbullying. They also learn to deal with their self image and identity. As they mature to adolescence and then to young adulthood, some of the important transitions they face might include dating or relationships, expectations related to their gender, cyberbullying, as well as creating their own self image and identity. When it comes to recognizing and providing for cognitive needs at the prenatal through the early years, developmental milestones can include language development, reading to children, pre literacy, playing with numbers and structures, and opportunities for creativity. At the elementary to middle childhood stage, recognizing and providing for cognitive development includes supporting the development of ability to engage in complex and abstract thinking, reasoning, decision making, and problem solving, as well as supporting the child's capacities to regulate and coordinate their own thinking. At the adolescent to post secondary stage, it means supporting the adolescent's use of complex thinking to focus on less self centered concepts and personal decision making, and supporting adolescents' emerging capacity to focus on thinking on their emerging role in society. Systems transitions are those that arise within and across systems. When families have to navigate multiple systems, such as health, education, and human services. For example, navigating multiple health related settings daily, such as primary care, specialists, early intervention, therapists, or care coordinators, or transitioning from prenatal care to infant care to pediatric care to adult health care. Again, this list is not exhaustive, and there may be many other systems transitions families experience. Take a minute and pause the recording and think about any systems transitions in your own practice or systems transitions you've experienced in your own life. How did they impact the families you work with or your own family? When you're ready to resume, just push play. Some families experience unanticipated transitions, which are transitions generally experienced by fewer families. Although they may be experienced by fewer families, they can still have significant implications for families. Some unanticipated transitions might be a change in the family structures, or transitions in housing arrangements, or any of the others that you see on this list. Take a minute and pause this recording and think about any unexpected transitions you've experienced in your own life. If you've experienced any, how did they impact you and your own family? When you're ready to resume, just push play. A number of practices help family, youth, and children anticipate and navigate specific transitions in the education, health, and human services sectors. However, there are some practices highlighted within the elements of the framework that can be applied more generally to transitions, regardless of the sector or the system in which they happen. These practices include, but they're not limited to, including family and youth voice in identifying effective practices for navigating transitions, supporting families in spaces and places where they already meet in order to provide information about transitions, using multiple modes of sharing information, including social media, based on family preference, providing information and resources about transitions in languages spoken by the family served, and collaborating with others like families, schools, healthcare, and community organizations to assist in anticipating and navigating transitions. Organizations should, with families, reflect on their overall transition practices, as well as those that are related to the specific sector associated with the organization, such as education, health, or human services. This module digs into the ways organizations can support transitions through the framework. To illustrate the types of strategies identified in the framework, we're going to explore the strategies in education, health, and the human service sectors. Remember, the framework addresses all three. The framework provides some examples of transition practices for each of the four elements. You'll recognize them by the icons. Some of the transition practices you'll find in the framework relate to more than one element. Here are some of the examples of the health-related transition practices included in the framework. There are many others included, such as offering opportunities to share information on general child development or specific topics like postpartum issues, nutrition, children's health, developmental milestones, and anticipatory guidance in transition to young adulthood. Another example that is included is providing training around screening to identify youth at risk for substance misuse. Again, the list in the framework is just a sample of practices that are often used effectively to support families with transitions. If you work in the health sector, you may know other practices that are not included. Can you think of any ways you support families through transitions that we haven't listed? If you need to pause the recording to reread the list and add a few strategies you've already used effectively, just push play when you're ready to resume. Just as with the health related transition practices, human service related practices have icons that illustrate which element they represent. As you read the framework, you'll even notice that several have more than one element. Other human service related transition practices include things like conducting mapping activities in order to understand the existing supports, services, and systems, and using that information to create wraparound services for families. Another strategy is creating one intake system that is centralized for family supports. If you work in the human services sector, you may know of some that weren't included on this list. You may want to pause this recording and add a few of your own. Go ahead and take a minute to read this list and add any that have worked for you in the past. When you're ready to resume, just push play. There are many examples of education related transition practices included in the framework. This is an example of some of the practices included, but there are many others. For example, one of the education related practices is to establish spaces intentionally designed for families in elementary, middle, and high schools. That practice relates to both promoting pathways for partnerships with families as well as promoting family well being. Remember, the list provided in the framework is not inclusive. You may know some that work in your own setting that haven't been listed. If you work in the education sector, can you think of any ways you've supported families in transition in the past? Feel free to pause this recording, take a minute, and jot down some of your favorite strategies. When you're ready to resume, just push play. Strengthening capacity for family engagement starts within an organization. Emphasis is a fundamental priority and builds on the skills and engagement of every member within the organization as it relates to interactions, connections, and experiences with families. The framework lists strengthening strategies organizations can take related to staffing, training and professional development, resource development, and evaluation. Strengthening partnerships with families is not easy work. As we think about how to support them during transitions, and indeed throughout their children's lives, it's important to think about our own capacity to do the work. An important part of the framework is strengthening family and practitioner capacities to do this work. As we go through the different types of strengthening strategies, you'll be able to identify them by the color of the ring. Strengthening capacity around family engagement goes beyond providing practitioners with resources and increasing their expertise to engage families in a meaningful way to creating an organizational culture of family engagement. It involves a cultural shift from understanding family engagement as random acts of parent involvement to an intentional, ongoing, and consistent process of engaging each and every member of the family. The framework describes some of the ways to create that culture, such as allowing staff and leadership to learn from each other about effective family engagement practices, dismantling biases and inequities, including racism, and adopting the shared practices to strengthen the capacity of the entire organization. Another way is to recognize family strengths to engagement while also identifying and working to remove barriers. To create an organizational culture and climate that is supportive of family engagement, it's necessary to reflect on the skills and the capacity of all staff to engage with families across all roles and levels of responsibility, from frontline staff through organizational leadership. Having staff whose jobs are focused on family engagement can be a great asset to strengthening partnerships with families. But it's essential that organizations focus on the capacity of all staff within an organization to ensure that families feel supported and valued in all their interactions and engagement opportunities. The framework provides several examples of strategies that could strengthen an organization through staffing, such as ensuring the leadership team supports family members as they develop skills as advocates and leaders, or ensuring that staff reflect the diversity of the families they serve, and acknowledging that having all staff embrace family engagement and build relationships with families is critical. Other strategies include making sure every level of staff supports family engagement and having staff and leaders link families to community opportunities for peer networking, volunteer activities, internships, and other experiences to expand their personal and professional interests. There are a lot of places in Massachusetts where these things are already happening. For example, through the Department of Transitional Assistance Works program, qualified clients bring lived experience to work with families as interns and for some, eventually as staff. Also, DTA staff provide opportunities to build capacity in family engagement by mentoring DTA Works interns and receive additional agency recognized training to support that role. At the Department of Early Childhood and Care, they try whenever possible to hire diverse staff who speak the same languages as the families they serve. This helps staff better understand the community and is a crucial step in building trust. PK is the Parent Institute for Quality Education. PK is a national organization that has programs in Massachusetts and provides evidence based programs that engage, empower, and transform families to actively engage in their children's education and strengthening family school collaboration. When they work with districts, they help districts ensure that everybody's roles are well defined. This ensures that staff are comfortable with their roles and better able to support families. The training and professional development of practitioners and families is an important way organizations can strengthen the competencies of families and practitioners to build meaningful, balanced partnerships. The dual capacity building framework was developed by Dr. Karen Mapp and her colleagues in 2013 and updated in 2019. It was developed to help build the capacity of families and schools to work together in partnership. The dual capacity for family engagement includes The importance of building the capabilities, connections, confidence, and cognition of families and practitioners related to engagement. In addition, the Association for Maternal and Child Health Programs states leaders can be developed by enhancing one's natural ability with learned skill development through formal and informal learning opportunities, experience, dialogue, role modeling, feedback, mentoring, coaching, and more. Offering a 2-hour training without coaching or follow up reflection opportunities is not as effective as in strengthening competencies and changing practices as when those added supports are included as a part of a comprehensive training and professional development plan. The framework has a lot of examples of training and professional development strategies that strengthen organizations. Training, either pre service or in service, could include, but is not limited to, developing one to one relationships with families and rebuilding trust, incorporating family engagement strategies into everyday practice, working with families from other cultures, language, and belief systems, dismantling systemic and individual racism and implicit bias, active listening, and building agency of families to ensure they have an active voice in family engagement initiatives. There are other examples of the type of pre service or in service training that would strengthen the competencies of all staff. For example, DTA Works interns inform policy and program effectiveness through quarterly focus groups attended by their commissioner. The Early Intervention Project, Parent Leadership Project, works to ensure that all families have access to information and opportunities they need to navigate through early intervention and beyond. They support families to develop their leadership skills. This is achieved through family engagement, sharing information, providing resources through the website, newsletter, trainings, conferences, and social media, and fostering connections throughout the Massachusetts early intervention system. Access to resources is an important component in strengthening the competencies of families and practitioners. Authentically engaging with families by having their voice represented in planning and implementation is an important element of family engagement work, including the development of resources. While some resources have a financial cost associated with them, not all do. Understanding and leveraging resources that are currently available, like online or in the community, is an important strategy to support effective resource development and use. Additionally, in partnership with families, taking the time to build relationships with other community organizations ensures that practitioners are equipped to connect families with resources based on their needs and what's available. The framework includes many useful resource development strategies to strengthen family engagement, such as having staff and leadership create a welcoming environment for all families. It should be a space that supports positive interactions and building strong relationships. Another strategy is to create a community map to help recognize and aggregate all community resources available to families. Staff should be provided with the tools they need to successfully engage all families, like phones, iPads, and space to work. They should ensure all materials and resources are available in multiple languages and represent the varied cultures of families. It's really important to get family feedback on client communications and brochures prior to releasing them to the public. And finally, taking a two-gen or whole family approach in procurement of employment support services to help cultivate partnerships that support agency direction. Two-gen approaches build family well-being by intentionally and simultaneously working with children and the adults in their lives together. The approach recognizes that families come in all different shapes and sizes, and that families define themselves. The Language Interpretation Services Project is another example of resource development. This service is in 20 districts and provides on demand telephonic interpretation services in over 380 languages, 24 hours a day, 7 days a week. They also offer an interpreter and translator in education training workshop series to train bilingual in district staff on standards and procedures for interpretation and translation to 100 participants each year. For many family engagement coordinators, a lot of their resource development depends on their knowledge and relationships within their local communities. They build relationships with other agencies and organizations and then share their knowledge with families so they can learn about other resources within the community. In some communities, they've combined wraparound service coordination and family engagement centers to deliver comprehensive services to families. Evaluation is an important component to better understanding the impact that family engagement opportunities have on children, youth, families, and practitioners. Evaluation should include qualitative and quantitative data collection methods that reflect both the number of opportunities provided and participants served, as well as the impact that these opportunities have on the outcomes for the intended audience. Evaluation should be planned prior to implementation of family engagement opportunities and should start with a reflection on what the goal of the opportunity is, followed by a plan for how the organization will document whether the goal was met. A reflection on how the evaluation data should be used should be considered when determining the plan for evaluating opportunities. Some of the strategies included in the framework include having a leadership team that encourages staff to be involved in the process of continuous quality improvement through the use of resources such as learning communities and data dashboards. Also, staff and leadership should commit to evaluating their family engagement practices and identify a clear vision for family engagement with measurable goals that they use to guide the evaluation practices. Another strategy from the framework is for staff to engage in collecting family level data using multiple sources and having staff and leadership use data to track family and organizational progress. Included within the framework, you will also find a glossary of terms and references from materials used in the development of the framework, including federal and state resources, resources from foundations, agencies, and research organizations, books about family engagement, and selected resources to evaluate family engagement. Now let's take a minute and think about the key takeaways from this module. The framework addresses four different types of transitions. The first type is developmental. Child and family development transitions are those that arise as a result of changes in age and the developmental stage of children in the family. The second is everyday transitions. They arise from the daily changes in situations and circumstances faced by families. The third is systems transitions. Those arise within and across systems when families have to navigate multiple systems such as health, education, and human services. And the fourth is unanticipated transitions. These are generally experienced by fewer families, such as transitions in family structures, housing arrangements, financial stability, and discipline systems. Each transition includes examples of the types of transitions and suggestions for practices that organizations can put in place to help families strengthen their capacity to navigate them, along with the family engagement elements that align with each of them. The framework also recognizes that strengthening capacity around family engagement goes beyond providing practitioners with resources and increasing their expertise to engage families in meaningful ways to creating an organizational culture of family engagement that is equitable and inclusive. The framework explores capacity strengthening in staffing, training and professional development, resource development, and evaluation. This module was one of four developed to better understand the Massachusetts framework for family engagement. Other topics included an introduction to the framework, a deeper dive into the framework, and culturally responsive family engagement. For more information on the modules and the Massachusetts framework, please contact the Massachusetts Statewide Family Engagement Center. Their contact information is on the screen. And thank you for participating in this module.